My name is Danny Benjamin. I'm the Distinguished Professor of Pediatrics at Duke University. The most important thing to me in providing medical care is trust between families and physicians, and to me that's the most important thing to establish. The patients that I see are primarily very immune compromised children, so premature infants with severe infection, children with HIV, children with unusual infections, children who've had a stem cell transplant or chemotherapy and are at high risk for infection. My best work is infections in premature infants. The children who've had the biggest impact on me are the premature infants who are kind of 24 to 26 weeks, who they can't talk, so they can't give you their symptoms and they can't tell you how they're responding to therapy. And the amount that we know about how to appropriately dose and treat them is very limited based on the limited amount of research that's been done in that arena. And so it's that group of patients where medicine is really as much art as it is facts. And that's one of the things that I enjoy about that group of infants, is all of the uncertainty and the judgment and decision making that has to go on with extremely limited information. My favorite part of my job is that I'm in a setting where I can figure out the right dose to give through my research, and then weeks later I can go ahead and help the next patient who comes along by applying that knowledge right away. And to me that's the most rewarding thing, is to have children and families and physicians work together not only to help the child at the bedside, but the next child who comes into the unit.